Are you having problems with your mental health but unsure of how to get help? If so, visit any of our Prime Health clinics to speak with a doctor who can refer you to a clinical psychologist. We recently sat down with clinical psychologist Dr.Mphele to understand what mental health is, and this is what she had to share.
My name is Dr. Mphele. I'm a clinical psychologist. I've been practicing psychology for 3 decades now, over 3 decades really. I've worked for different organizations, mostly academic organizations. My last academic employment was with the University of Botswana, where I started at the counseling center, and then I moved on to the psychology department, where I was one of the people who were training our psychology students and also supervising their clinical work. And while I was still there, in 2008, I started my practice while I was still working for the university. So I was doing it on part-time, but I really fell in love with it because I've always been hands-on. So 2014, I decided to retire and do the practice full-time.
Thank you so much. So today we're going to be talking about mental awareness.
Mm-hmm.
So my first question for you, doctor, is what is mental health?
You know, human beings are biological, emotional, and psychosocial. So really, when we have the medical side dealing with the physical, the biological aspect of us, mental health seeks to deal with the emotional, the psychological, and the social well-being of human beings. So in other words, it is important in our thinking and our feelings and our actions as all these come together to influence our behavior.
So what are the most common reoccurring mental health illnesses?
Mental health illnesses are diverse, but the most common are mood disorders. That will be your depression and bipolar, your anxiety disorders, your psychotic disorders, that will be your schizophrenias, because there's a group of them, and some personality or behavior disorders. And we now begin to see, or we have long started to see, particularly since COVID, relational problems.
Okay. So then what is your experience with treating mental health conditions?
I really can say my experience has been exciting and very, very rewarding. But like everything else that we do, sometimes I get frustrated and sometimes ask myself, have I done the best that I could have done with that particular person or that particular case, particularly where sometimes I've had experiences where I've seen someone and I thought I was on the right track. 1 or 2 or twice I have lost a patient either to suicide or homicide, suicide, homicide kind of thing, and it leaves me wondering, what did I miss? But this is really what it is. Sometimes you second judge yourself and say, what is it that I could have done? But overall, the experience has been very rewarding and growth producing.
What is the most common one among the youth, and what is the most common one among adults? What are the warning signs for both?
Okay. Among both the youth and the adults, we do get a lot of mood disorders. That will be your depression and bipolar. We also get anxiety disorders. We also have relationship problems. Among the youth, and these that I've mentioned, they've since peaked. Since COVID, they have peaked. And among the youth, we also see a lot of behavior problems and relational problems too.
How can one ask for help? What are the common symptoms to look out for, especially for parents dealing with depressed children?
Okay. Asking for help is not always easy. Most of the people who we get to see as mental health specialists, they do come to us through referrals. Oftentimes, they will either be referred by their other professionals or their parents or their friends. Most of the time, they do present to GPs as physically sick, because sometimes in fact, most of the time, mental health affects our physical functioning. So oftentimes the person will present to a GP as physically sick. And when the GP cannot find anything that can explain that, that's how they end to us, with us. But also friends and family, they do refer. Okay. Again, the symptoms to watch for, particularly for parents looking at children. When someone changes behavior, becoming very isolated and experiencing lows and highs in moods, and also changes in concentration, where sometimes they would be confused and they zone off most of the time, isolating. And with young people, when this person used to behave like this, always very interactive and engaging, and they begin to go too much into their room and stay there, and they become irritable. Irritability will be one of those things where you never know what really has checked off the person, but they seem to be attacking everyone and everything. And those are some of the warning signs. And some of the warning signs also might include the significant tiredness, fatigue, where parents might even say, this person has become very lazy. They never want to do anything. Sometimes you see someone starting something but not really completing because they are anxious. There is this extreme fear of the unknown, and because of that, people seem to avoid getting into things that perhaps they used to do. Now they go into themselves, call it anhedonia. And sometimes there's also changes in appetite. This person has been eating in a certain way. Now there are changes in appetite. They either eat too much or they don't eat at all. Changes in sleep. The person, particularly with the young people, when they have been sleeping at a particular time, now you see them spending a lot of time not sleeping. And changes in the use of substances. If someone has been smoking or drinking, but you know that they were responsible about it, you see that now going up. And most importantly, for the young people, changes in personal hygiene. You get into the young person's room, it looks like a tornado has just passed through there. Everything is upside down. They don't want to bath. You have to ask them, have you taken a bath? Are you going to take a shower today? So grooming gets out of the window. All these things are really significant because they are pointing to some poor mental health.
So then what is the number one trend people try to use to deal with mental health illnesses which does not work?
Oftentimes we see a lot of self-medication. People will particularly go to overuse of substances. If someone has been drinking, or sometimes someone has not even been using any substance, we see them initiating the use because it becomes physically painful. It's a mental health thing, but it becomes physically painful rather. So people want something that can numb the pain. So not only illegal substances, they also might even abuse their medications. So someone might say, I've been having this headache for so long, and they go and get some medication, whether prescribed or not, and they're likely to pop those pills because you know what, that headache is not reacting to the painkiller, and they want to numb the pain. So it's all about numbing the pain. So people go into things that are not working. Substance use has since increased as we begin to see an increase in mental health problems, and also the use of food. Some people will go to food, they call it emotional eating. Just remember, I've said mental illness has the emotional aspect. So people will also bury themselves in that. And when that happens and they pile up the weight, the guilt also happens. And when that guilt happens, the isolation, because now they begin to second guess themselves, they become very self-critical, and it becomes a vicious cycle.
In conclusion, what advice can you give to people struggling with mental health?
Seek help. Seek help. And as I have said, because we are used to really thinking we seek help when I can see I have a boil here, I have a wound, my heart is not beating well. When we do really feel the physical symptoms, sometimes it's confusing and it's very difficult for people to immediately seek help because they are not feeling what they might say, particularly parents. When the person is not well mentally and they begin to go into themselves, the parents might think, that's laziness, that's what. When the person might say, I'm not well, they don't see anything on the body. And they tend not to really agree that the person is not well. So it is seek help. Again, we can do some things that are protective. Don't be a volcano. Learn to talk about your feelings, both negative and positive. So find a safe place where you can talk about your feelings. That safe place can be a person, can be a group where you can really, because people are not volcanoes. But you know what, Santi? Even volcanoes don't keep things in forever.
That's true.
Also, make sure you get enough sleep. I always say to people, it's important to really have a bedtime. Get enough sleep. Eat well. Gone are the days when we used to think eating well is piling up with the fats, piling up with the starch. Have a balanced diet. That healthy metabolism will help you to stay mentally healthy. In addition to that, also make sure you don't disconnect. Develop healthy relationships and nurture those healthy relationships. Those are some of the things that we can do, and they're very protective. Be physically active. You know, our forefathers didn't have much as far as mental health is concerned because they were super active. You cannot wake up and run a marathon, but you can do what you can do to make sure that you continue moving. Moving is very important. So be physically active. Take care of yourself. And most importantly, don't hesitate to take time off and be in the moment. Mindfulness. Relax and be in the moment. That is very important. And that, among other things, can protect our mental health.
For further information, contact us at 390-3066.